Hi everyone, this is Shinuja, Assistant Professor, Department of Biotechnology, St. Josephs College of Arts and Science for Women, Hosur. Today's topic is pharmacodynamics. Pharmacodynamic is the study of a drug's molecular, biochemical, and physiological effects or actions. It comes from the Greek word pharmakon means drug and dynamikos means power. And then principles of drug action. Drug action is the pharmacodynamic parameter in which the study of drug effects and their action is described. One drug alters or inhibits the action of another drug. Drugs don't produce new functions to any cell or tissues or organs. They just alter the effect of the specific activity. The basic drug action is classified as stimulation, depression, irritation, replacement, and cytotoxic action. Stimulation. Stimulation is defined as the enhancement of the level of activity of specified cells. Example for stimulations are adrenaline stimulates the heart, pilocarpine which stimulates the salivary gland. Central nervous system stimulant action is produced by a high dose of picrotoxin. Next one is depression. Depression is defined as the selective reduction of the activity of specialized cells. Examples are central nervous system depressant action is produced by barbiturates and quinidine depresses the heart. Acetylcholine stimulates intestinal smooth muscles but depresses SA node in the heart. Irritation. This predicate a non-selective, often toxic effect on the specialized cells, that is, epithelial cells and connective tissues. Strong irritation can also lead to inflammation, corrosion, and necrosis, etc. Next one is replacement. Replacement is defined as the use of natural metabolites, hormones, or their derivatives in the state of deficiency. Example, levodopa is used in Parkinsonism and insulin is used in diabetes mellitus. Iron is used in anemia. Next one is cytotoxic action. Cytotoxic action is the toxin action on cancer cells or on the growing parasites without significantly affecting the host cell that are used for the diagnosis of infection and neoplasm. Examples are penicillin, zidovudin, chloroquine. Mechanism of drug action. The steps and path followed by the drug to produce its pharmacological action are called the mechanism of action. The mechanism of drug actions are through receptors, through enzymes, through ion channels, by physical action, by chemical action, and by altering metabolic processes. Through receptor. Receptors are macromolecular protein substance present either on the surface of the cell or inside the cell. Drug or chemicals bind to the receptor. Example is histamine receptor. Through enzymes. Enzymes are complex structure of protein that are produced by cells and act as a catalyst in specific biochemical reaction. Enzymatic activity can be increased by enzyme induction, whereas enzyme activity decreases when enzyme inhibition occurs. Drug can either increase or decrease the rate of reaction mediated by the enzyme. The example is allopurinol inhibit xanthine oxidase. Next mechanism of action is through ion channel. Drug modify the movement of ion across specific channel either by opening or closing them. The example is calcium channel blocker, that is nifedipine. By physical action, the first action is adsorption. Magnesium trisilicate acts as an antacid by adsorbing hydrochloric acid in the stomach. Next one is osmotic property. Magnesium sulfate produces a purgative effect due to osmosis. Radioactivity. Radioactive isotopes used for the treatment of cancer produce their effect by emitting ionizing radiation. Next one by chemical action. That is antacid. The antacid act by neutralizing the acid in the stomach and by inhibiting pepsin, which is a proteolytic enzyme. Next one is oxidizing agent. An oxidizing agent uh, is a chemical species that tend to oxidize other substances, that is, cause an increase in the oxidation state of the